or some people refer to as a cap, is something that covers the tooth. And you may need one if your tooth has had a very large restoration that is failing and the restoration is not able to protect and seal the tooth properly anymore. You may need it if the tooth has chipped or fractured. You may need it if the tooth is discolored or oddly shaped, or you may need it with a dental implant. There may be other cases where we may need them, but those are the majority. A crown can come in different materials. We can do a porcelain fused to a metal. We can do a full porcelain, a zirconia, or a glass type crown. And then the other option would be a gold crown. So in my brochure, you can see, this is a porcelain fused to metal, which looks like a tooth colored. The porcelain, all porcelain, is tooth colored, and then the gold is obviously yellow and gold. Very strong, all of them are very strong and very durable. These are what crowns look like as they come back from the lab. This is a zirconia crown, which we refer to as porcelain. So it looks like a tooth. That would be for in the back, and this is one for in the front. So when we prep a tooth for a crown, we basically make the tooth a smaller version of itself, kind of like a cowboy hat is how I explain it. And then we fit it, we send an impression of that to the lab, and they design and make your crown to fit over there. And that protects the tooth and then seals the tooth. And you're ready to go. Crowns have an average life of roughly around 15 years. It all depends on your diet, how often you come to the dentist for recare, and how well you do brushing and flossing and taking care of your teeth at home. If you have questions, let us know.